All right. Hello, everyone, and thank you for joining us today, and welcome to the May Research Seminar Series event. My name is Cheyenne Head, and I'm a research assistant at the BC Brain Wellness Program. I'm very excited to be hosting today's event. We have Dr. Noah Silverberg joining us today, who will be presenting When Forgetting is Not Dementia. Before we dive into the session, we would first like to acknowledge that the BC Brain Wellness Program at the Javid Moafagian Center for Brain Health is situated on the traditional, ancestral, and unceded territory of the Hunkaminam-speaking Musqueam peoples. I am also joining from Vancouver and would like to invite you all to take a moment to acknowledge and give thanks to the land that you are joining us from today. If you have any questions or thoughts throughout the session, please feel free to send them in the chat box and we will get to them during our Q&A period at the end of the talk. Please note that we will also be recording today's session and uploading it to our YouTube channel. Today, we are very excited to have Dr. Noah Silverberg presenting on When Forgetting is Not Dementia and some of his research findings. Noah Silverberg is a board-certified neuropsychologist and assistant professor in the Department of Psychology at UBC. He is a principal investigator with the Rehabilitation Research Program at GF Strong Rehab Center and the Javid Moafagian Center for Brain Health. Without further ado, the floor is yours, Dr. Silverberg.
Thanks so much for having me today and for that introduction. Can I just get a thumbs up that you're hearing me okay and seeing my full slide on the screen there? Okay, perfect. Good. I will get underway then. So I heard that we have higher than typical numbers in attendance today, and I hope that's not an indication that you're all terribly worried about your memory. If you are, you may well be in the majority actually, and I hope to shed some insights on why it is in fact so common that people get concerned about their memory to the point of even seeking medical attention or making lifestyle changes, and oftentimes their memory is actually just fine. So we'll explore that discrepancy. That'll be sort of the focus of the talk today. So this question, why do neurological symptoms often persist after a brain injury is healed or even in the absence of brain injury or disease, is one of the central questions that drives my research program. Neurological symptoms can, of course, refer to a lot of different things. Today, we'll focus on memory. We're also interested in other kinds of symptoms like headaches and light and noise sensitivity and fatigue and so on. And you'll hear in a moment that a major focus of our research program is concussion. And hopefully it'll make sense in a few minutes why we are studying people who have experienced concussion as a way to try to answer this bigger question that probably applies more broadly. So I just want to introduce a term. The term itself probably won't be familiar, but the concept may well be, which is functional cognitive disorder, or FCD for short. And what this refers to is a condition where people are experiencing memory or other kinds of cognitive difficulties that are not the direct result of structural injury to the brain. So I'll use that term FCD kind of throughout. So in FCD, the experience of memory problems are absolutely real. They're distressing, they're disruptive. They can interfere with people's life and daily activities in a lot of different ways. For example, if people come to distrust their memory, they might avoid situations that demand memory as to, avoid looking stupid or being embarrassed or for a variety of other related reasons. An analogy that may help to understand functional cognitive disorder is to compare our brain to a computer, because we love to do that. In FCD, we're talking really about a software problem as opposed to a hardware problem, so that the actual brain structures that we need to remember things are intact, but there is software malfunctioning. Something is getting in the way of optimal memory use. So we can think about self-assessment, our own reflection on our cognitive abilities like memory and how well they're working, as being kind of on a continuum as far as how well matched they are to our actual abilities. So over on the far left is what we might refer to as anosognosia. That's the medical term for it, when people have severe impairments, such as with their memory, but are kind of oblivious to those. They don't recognize that their memory is impaired. So there's a discrepancy here, but it's in the opposite direction that we're talking about today, where people's objective memory function is bad, but they feel as if they don't have a problem. So it's characterized by under concern, low awareness of deficits, and so on. Normal self-assessment is kind of in the middle of this showing. Notice there's a broad range of normal. Turns out humans are not very good at assessing their own abilities, and so we tend to be off a little in one direction or the other, but that's the whole middle of the continuum. Oh, I should mention that conditions where we often see people more on the left side of the spectrum characterized by an under-awareness or appreciation of their deficits is in dementia, severe traumatic brain injury, schizophrenia, conditions like that. Now, finally, over to the far right, that's where we're getting into FCD territory, where the discrepancy is in the opposite direction. So people's objective ability to remember things is much better than they feel it is. It's in this state, people are often very aware of any little memory lapses they make and are quite concerned about them, probably more so than they need to be. So that's sort of the continuum approach. This is more of a categorical approach of saying the same thing. So if we combine what people think about their memory, it's okay, it's not okay, they're either right or wrong about that. And so if you combine those two dimensions, there are four possibilities, right? And FCD is the combination of feeling as if something is terribly wrong, but actually memory ability works fine, at least under certain conditions, and the underlying brain structures necessary for remembering are intact. So that's the hardware of the brain. Okay. So I'll just tell you a little bit about my research program and our approach to studying this problem. So we have a lab at UBC, just over in the Kenny building, and also have space inside JF Strong Rehabilitation Center, which some of you may have heard of. It's British Columbia's tertiary rehabilitation facility around Oak and King Edward. So as I mentioned a few minutes ago, we focus primarily on concussion, which is also referred to as mild traumatic brain injury, which I'll just give you a little bit of background about. Concussions are super common. We see probably upwards of 300,000 of them a year in Canada. Concussions are the most common form of traumatic brain injury. So traumatic brain injury can range greatly in its severity. At one extreme, where people, if they survive, have a lengthy coma and often hospitalization and a permanent disability and so on. And at the other end of that spectrum is concussion, or the mildest form of traumatic brain injury. People get concussions in all kinds of ways, and the ways that people get hurt vary some with age. Throughout adulthood, the most common are falls, motor vehicle accidents, and other kinds of recreational accidents. So the prognosis for concussion is generally good. Most people make a complete recovery within days up to a few weeks or even a few months in terms of their brain physiology, but it is pretty common for people to experience some lingering symptoms, memory problems being among the most common. Okay. So why are we using concussion as a way to try to understand FCD? There are a few reasons for it. One is that concussion obviously provides a reason for people to become concerned with their memory. Okay, so even people who think they might have a concussion, perhaps didn't actually have a concussion, they might still expect to experience cognitive problems. So if you haven't had one, and I asked you, what kinds of things do people struggle with after concussion, forgetfulness and memory problems would probably be among the things you list. People who have had a concussion often do have cognitive impairment in the early days, whether that's because the physiological effects of brain injury from head trauma, or other things going on. They've injured other parts of their body and they're in a lot of pain, or they're taking medications for pain that disrupt their cognition, or they were injured in a way that was psychologically traumatic, and that's creating a lot of distress for them. So there's lots of reasons to have cognitive difficulties in the early days. So that sort of sets up an initial concern that even though we see good healing and resolution of those cognitive deficits, the concerns about memory can persist for reasons that we'll get into shortly. So that's sort of the first major reason. The second reason why we're studying concussion to learn about FCD is that, and I sort of mentioned this already, we've come to learn a lot about the natural course of concussion and the way that symptoms improve over time and test scores improve over time, and the underlying biology. And we can see pretty clearly that recovery is good, okay? But as I mentioned, there's often this mismatch between the brain's ability to recover after concussion and the kinds of symptoms that people are noticing or experiencing. So that discrepancy between subjective and objective functioning, the way people feel and the way they actually perform, is actually pretty characteristic of concussion and, of course, of FCD. And finally, people have, including our group, have studied quite a bit these persistent cognitive symptoms that can hang around for a long while after concussion and understand why they're there. And what we know so far is that those persistent memory symptoms are strongly correlated with psychological distress and pre-injury health problems, particularly mental health difficulties. So that may set up some kind of vulnerability. And we know that persistent cognitive symptoms are almost entirely unrelated to objective test performance. So when we see people months or even years after concussion, they tell us their memory is really bad. We test their memory, we give them a bunch of standardized measures, get them to remember things, see how well they perform. The two things are basically unrelated, interestingly enough, and also not related to what we see in terms of their brain structure through neuroimaging. So different kinds of fancy techniques for taking pictures of the brain structure and its connections don't seem to correlate much at all with how people feel as far as how good their memory is after concussion. So in our lab, we go about studying this problem in a few different ways. I'll just sort of walk you through them. The most basic is just through questionnaires and interviews, which is just get people's own perspective about what's happening for them, what they're noticing in terms of their views about their memory problems, the kinds of memory difficulties they're experiencing, the beliefs they have about their condition, like how likely it is to get better, how upsetting it is for them, how they cope with it, that sort of thing. Another thing we do is with neuropsychological testing. So these are standardized tests of memory and other thinking skills. And this is one example. So I'll just walk you through what you're seeing here. So in this test, we give people 15 words to remember, okay? And we read the list to them aloud a few times and get them to say back as many as they remember. We do that again and again and again, giving them a chance to really learn. But before all that, just when we explain the test, we ask people to make a prediction about how well they're going to do, okay? And that is the first set of data you're seeing there on the graph. So the black line represents people who have had a concussion. And when we ask them to predict how well they're going to do, they're pretty pessimistic. They expect to recall, maybe about 8 out of 15 words. That's what the first bit of data in the graph is showing there. And then we actually test their memory. So we wait some time, we have them do other things, and we come back and say, hey, remember that list of 15 words that I read you about 20 minutes ago? Can you tell me now how many tell me all the ones that you remember? And this group of patients could remember considerably more, about 11 or 12 words on average. And compare that to the healthy controls. They're the orange line there, who come in much more confident, overconfident. In fact, they think they're going to remember almost all the words, and they don't do as well, but the actual performance doesn't differ between the two groups. So their memory ability or accuracy is the same, but what's really different about these two groups is their sense of how hard it is, their sort of anticipation. Okay, so that may be a reflection of people's difficulty self-assessing their memory and therefore making predictions about how they're going to perform in one situation or another. Okay, another way that we go about studying this is through experimental cognitive tasks. So these are sort of borrowing from the cognitive psychology field to measure some of these constructs a little bit more precisely. So traditionally, we would just ask people, like, how good is your memory? We would test their memory, and we would look for a match or a discrepancy between those two. This is a bit more nuanced, where we give people a memory test where after every time we ask them, did I show you, which of these two words did I show you before and ask you to remember? We get them to answer, but then rate their confidence in that judgment they just made. And they do that over and over and over again. And so we can then plot their accuracy against their confidence in their answer and get a sense of overall how sort of under or overconfident they are. So this is a relatively new paradigm that we've been using in our lab. And lastly, we're trying to understand what is happening in the brain and body when people are making predictions about how well they're going to do, or they're evaluating their own performance, or they're doing a task and running into difficulty, or at least perceiving that they're running into difficulty. So the top picture is EEG. So we're measuring electrical activity in the brain. And the bottom picture is of electrodermal activity or skin conductance, measuring sort of a sweat response. We're looking at whether people are having strong, first of all, whether they're noticing their errors more than other people would. The EEG can help tell us that. And then whether they're having sort of a heightened stress response to that experience of an error, which the technique at the bottom there might shed some light on. We've also always done clinical trials or developing and testing new treatments. That's been a big part of what my lab does. And in the area of FCD, we're just starting to get to that now. So in order to do this, we first have to understand sort of how this condition works and what are the factors keeping people feeling that their memory is impaired. And then we can develop treatments that are designed to address that target. So the first thing we did was to look at metacognition, which just refers to people's ability to self-assess their performance accurately. We looked at that as a potential treatment target. And what we've learned so far is that actually that doesn't seem to be the thing that people are struggling with here. If you just give them a task and ask them to rate their confidence trial, they look a lot like healthy people. And also that when you provide metacognitive training, so you give them feedback on how closely their confidence matches their accuracy over and over and over again, they make similar use of that to healthy people. They don't benefit any more than people without memory concerns after a concussion. So this does not seem like a very promising avenue. So we continue to look for other targets and other approaches to treatment. Okay, so that's about my research program, but I'm just going to zoom out now and give a little bit more background about FCD, functional cognitive disorder. So this is kind of a formal definition. These are diagnostic criteria. This is what your doctor will have in front of them if they're trying to make a determination about whether you have FCD or not. You know, the essential bits of this definition are things that I've already said. There's, you know, people feel as if they have memory difficulties, that those difficulties are not fully explained by a medical condition or a psychiatric condition. And the other thing to point out here is that a prominent feature of this condition is internal inconsistency. So it's this idea that memory can work well at some times, but not other times, or in some situations, but not other situations, or other kinds of discrepancies. A really common one is people will come into clinic with really severe memory complaints. So they're explaining that, oh yeah, I forget all the time, I'm having a lot of trouble remembering this and that. And the doctor says, well, can you give me an example of what you mean? Somebody with dementia will have a really hard time elaborating on that. They might make some very vague statements, or say, I don't know, or turn to a partner or caregiver to provide an example for them. But people with FCD can often give very vivid details about an instance in which they forgot, which is a paradox, right? You say that your memory is really terrible, but yet if I ask you about a time that you forgot something, you can tell me all about it. You have a vivid memory of it. So that's an example of an internal inconsistency that's characteristic of FCD. I'll say that just like you can have a cold and a broken arm, you can have FCD and another neurological condition. That's pretty common, actually, for FCD to coexist with stroke or Parkinson's disease or some other condition. So there would be the primary symptoms associated with Parkinson's, let's say, but people feel as if their memory is really terrible, and all indications are that it's not, or that it works better at some times and not others, and that's probably FCD sort of on top of Parkinson's. So FCD is not a rare phenomenon. There's been a lot of studies looking at its incidence, how often it shows up in memory or dementia clinics. And the short story is about a quarter of all people who go to see a doctor out of concern that they have dementia, in fact, more likely have FCD. So this is a pretty common phenomenon we're talking about here. I just want to point out how FCD is different than what is often referred to as subjective cognitive decline, which is similar in that people report having a memory problem but perform fine on testing, but in fact is thought to be sort of early Alzheimer's or some state that will eventually turn into Alzheimer's. So there's a lot of literature on this, and it's sort of tricky to sort through. I will just say there's a lot of debate about the usefulness of the concept of subjective cognitive decline, and partly because it's not that predictive. So yes, some people go on to develop dementia, but many don't. And there's also an unclear relationship between this state of having a subjective memory problem, but nothing that shows up on any kind of testing, and some other sort of research biomarkers of Alzheimer's disease. So it's difficult to say, but what we'll focus on today is just FCD as an entity, and sort of how to best tell the difference between what's FCD and what may be more likely the early start of a neurodegenerative condition. So the big question with FCD is, of course, if you follow people over time, do they go on to develop dementia, in which case that's not really FCD, that's something else. And we don't have a ton of data on this, but the data that we do have suggests that that doesn't happen. So in this cohort, for example, they were identified as having FCD and then followed for 10 years, and not one of them developed dementia. So it gives us a bit more faith that we know what we're looking at here. Okay, so why is it that somebody gets concerned about their memory to the point of actually having memory difficulties in daily life, even when their brain structure is fine? There's no permanent brain damage or disease causing that problem. And also, if it's just a software problem and the hardware is fine, why doesn't it just go away on its own? Because it tends not to. It tends to stick around. So we do not yet have really good answers to these questions, but I will walk you through one possible explanation for how this all works, kind of an emerging theory based on recent research. So the idea is that memory concern doesn't come completely out of the blue. It starts from somewhere. But the triggering event or situation could be a lot of different things. So in the case of concussion, obviously, life is going by just fine. All of a sudden you have an acute injury. You have good reason, as we talked about earlier, to be concerned about your memory and thinking skills initially. So that's an obvious trigger. But there are others, lots of reports about people developing FCD after a viral illness, after some kind of surgery or medical procedure, after a medication change, or after a loved one or somebody they know is diagnosed with dementia. So now the person is starting to reflect on their own memory and getting worried about things they're noticing. So something has to get the memory concern going in the first place. This is the sort of trigger or precipitant. But that alone is not enough to give you FCD. A couple of other things probably need to happen. One is you probably have to be stressing out about your memory to the point where all that worry and self-criticalness about your performance is actually getting in the way of your memory working at its best and causing memory lapses for you. When people notice that the memory is not working, the most natural response is to try harder, right, to remember things and putting pressure on themselves, because forgetting now means something scary. It's important, so I'm going to try extra hard. Well, trying extra hard isn't necessarily a good thing. And you can look at examples, for example, in the world of sports psychology, when golfers, are just one putt away from winning a tournament and they choke and can't make a putt that they could make, 99 times out of 100 on any other day. But because they're under intense pressure and perhaps motivated by that, trying extra hard and thinking about the mechanics of their swing and other things that they don't normally pay attention to, they don't perform as well as they can. And on a different scale, a similar kind of thing might be happening with memory difficulties. Okay, so that's one thing that probably needs to happen for a memory concern to develop into FCD, but there are also a couple of unhelpful behaviors that probably are part of this picture as well. These are things that people don't necessarily do on purpose. They come natural, they make total sense. It just turns out that they can be counterproductive. So one of those is hypervigilance, right? So if you're concerned about your memory, obviously you're going to be on the lookout for memory problems. That makes sense. The problem is that the more you look for something, the more you notice it, right? It's kind of like after you buy a new car, let's say, and it's a blue car, now you notice that there's blue cars all over, right? And maybe even the same make and model as you just bought. You see them all the time. Is it the case that everybody went out and bought the same car as you? Probably not. Those cars were always there. You just didn't take notice of it, right? So our attention really strongly influences what we notice. And so people who are concerned about their memory tend to look out for any instance of memory lapse, and rather than just barely take notice and go on with their day, it really does grab their attention, because now all of a sudden it's a threat to their health and livelihood and future and so on. So that's hypervigilance. The other thing that people often do when they develop memory concern and notice forgetting is they lose trust in their memory, right? And so if you don't trust your memory, you're not going to rely on it and get yourself into trouble. And so what you tend to do is involve others for help. Like you ask, can you help remind me of this? Or, my memory's no good. Would you mind remembering that for me? Or you use lots of other compensatory strategies like writing lists and programming reminders and then things like that. Now, over time, people often stay in the habit of using those kinds of strategies and come to rely on them even more and more. And the more that you do that, and you don't fully need them, you're sort of reinforcing this idea that your memory is no good. And you don't get to experience, you don't have the opportunities to really see what your memory can do, because you're avoiding using it in the way that you used to, right? And so if you are remembering, you're probably attributing those memory successes to the very strategies that you've been using, which reinforces their use. So it gets into a bit of a cycle here that that people can get stuck in. So there's the hypervigilance, there's the avoidance, leading to people noticing more problems with forgetfulness. And then comes the way that we think about our memory problems, okay? So if I wasn't concerned about my memory and I misplaced my keys, I, again, probably wouldn't have much of a reaction to it. I would be maybe slightly annoyed, but I would go on with my day, right? But if I was worried that I might be developing dementia, I'm noticing more forgetfulness, and now I lose my keys, all of a sudden I have very different kinds of interpretations about how bad this is and what it means and how likely it is to happen again. And all of these kinds of upsetting thoughts can fuel the memory concern and keep it going. Now, people may also have personality traits or characteristics that make them a bit more susceptible. Memory perfectionism may be one of those, and it's just sort of like throwing gasoline on this fire here to keep it going. So memory perfectionism refers to really highly valuing a good memory, like it's an important part of who I am, of my identity, and being really intolerant to minor memory lapses, feeling like it's not okay to forget a new person's name who I just met, even though that's a really hard thing to do, and most everyone would forget, but for you that feels like it's not okay. And there's some research linking memory perfectionism to being a risk factor for developing FCD after concussion and in other conditions and situations as well. Okay, so that was just some more general background about FCD. And then basically the last thing I'm going to talk about today is sort of translating this into figuring out whether an individual perhaps more likely has FCD or more likely has some more serious, neurodegenerative brain condition, for example. The first clue that it may be FCD is age. So age is, of course, the strongest risk factor for dementia. And rates of dementia into people's 60s and 70s are still pretty low. And then they really go up quickly into the 80s and 90s. So the peak onset for FCD is typically much younger in people's 50s and 60s. So if you first become concerned about your memory and you're on the younger side of that range we've just been talking about, more likely that's FCD. And as you get older, into your 80s and beyond, that risk may actually flip over. Another clue may be FCD. It has to do with the nature of the kinds of things that you forget. So just get you to have a look at these things on the screen and see if you can identify with them. If you, for example, have done some of these things yourself in the past week, today even. Mind going blank, losing track of the conversation, misplacing things around the house, getting stuck on a word, etc. So these are all examples of quote unquote normal kinds of forgetting. So if you survey people who do not have a brain health condition and you ask them how often does this happen to you, the answer is a lot, right? So I'm showing two columns of data here. And if you lump them together, you add them, that'll give you the proportion of people who experience this kind of memory lapse at least once a week. Okay, so on a pretty regular basis. So difficulties finding a right word, entering a room and forgetting what you went in there for, misplacing a personal belonging like your phone. These are universal experiences at all ages. So if these are the kinds of memory difficulties you're having, that may be more consistent with FCD. I mentioned memory perfectionism already being a possible risk factor, and these are just some examples of things that people with memory perfectionism might say about themselves. So it's important to me to be very accurate. Good memory is something that I'm proud of, and so any even minor memory lapse is just going to feel like a bigger deal and you might have more of the kind of negative emotions and thoughts about it than other people do, which again may fuel FCD. I also mentioned this one before, so if you can describe times when you forget in vivid detail, more likely to be FCD. So this is a transcript of a patient. So the doctor asks the patient, tell me about the last time this happened to you, referring to a memory lapse. And the patient replies, we were out walking with friends and we're having a conversation. We're talking about the economy. I was having a conversation talking about Italy, and I remember it exactly, talking about Italy, and I got to the word economy and I couldn't remember it. I couldn't remember the word economy. And my sentence, everything just stopped, and I was like, phew, and everybody went, and so you can see the level of detail here, and the paradox that it highlights when people feel as if their memory is bad, but they can remember exactly when they forget and all about it. More likely FCD. Another clue that we might be more in the FCD territory is that your memory is okay at times. So in dementia, memory can also fluctuate, normally more from like bad to worse, whereas in FCD, memory can be normal at times, but be bad at other times for various reasons, stress or poor sleep, or anything on the right side of the list here can contribute to fluctuating performance, not just memory, but other kinds of cognitive skills as well. I'll just say a little bit more about stress. So this, if you took a Psychology 101 course at some point in your life, this may have stuck with you. This is the Yerkes-Dodson law, showing the relationship between performance in general, but here we'll talk about memory performance and arousal. And the idea is at low arousal, like if you're just not really engaged, you don't care much, you're not really into it, you're not going to perform at your best, okay? We perform at our best at moderate levels of arousal, okay? But there is such thing as too much of a good thing, because at excessive arousal, when we're really stressed or the pressure is really on, and our heart is going, and the outcome really matters to us, our performance suffers. And this may underlie the missed golf shot or yip or basketball free throw or whatever you want. Example is most helpful there. But the kind of thing that may also be happening in FCD, where people are in fact underperforming, and it's related to stress and pressure that they're putting on themselves and trying even harder. Another clue, possibly FCD, is that your loved ones are less concerned than you are about your memory. So it's been replicated a few times now in research that people with FCD tend to come to the doctor's office alone, maybe because their spouses, again, are not as concerned. In dementia, typically it's the family dragging the patient in, where the patient themselves are not terribly concerned, but others are concerned for them. So that's another difference we see between FCD and dementia. And finally, with FCD, typically the kinds of testing that is done to look at, take pictures of the brain to make sure the structures look okay, to do tests of memory and other cognitive skills all come back normal. Again, this doesn't mean it's not dementia or the early stages of what might become dementia on its own, but when taken together with the other 6 things we've talked about here, and they're all sort of pointing in the same direction, that gives us more confidence that it's FCD. And just to be clear, that the tests are normal does not mean somebody is not having problems with their memory in daily life, or that the problems are all in their head, or nothing's wrong. FCD is a serious health condition where people are really struggling. So it just means that their actual abilities to use their memory under best case scenario when these other things are not getting in the way And the software is working optimally is that they can be performing better. Okay, and just going to look at the flip side for a moment. So we've been talking about clues that point towards FCD. Now the opposite. So just a couple of things that would be more suggestive of neurological disease or dementia in particular. And these are just kind of the reverse of things that I've already told you about. So older age, patient lacks insight, so they're not aware of problems they're having. It's really their family that's raising concern. If there's been a pretty steady decline over months to years, more likely dementia. Yeah, abnormal testing, abnormal imaging. I think we've talked about all of these things. Okay, what can you do if you're worried about your memory? Well, the first thing is to understand how worried you need to be. And two ways to do that would be to talk to people who know you well and get a sense of whether they've noticed the same thing. Again, with FCD, often your concern is out of proportion or stronger than others who spend a lot of time with you. And also, you may want to get checked out and talk to your doctor about how you're doing, and they may want to order some tests to confirm that your memory is actually okay or not. Okay, but assuming that's all been done, you've taken all these steps, and your doctor has assured you that actually your memory is fine. We don't see any signs of dementia, but you're not feeling very reassured. You still feel very concerned about your memory. What can you do? Well, a couple of recommendations here. The first is keep using your memory. So do you remember earlier we looked at that cycle where people who get concerned about their memory, lose trust in it, don't want to rely on it, and tend to not use it much? Well, what happens when you don't use your memory ability much? It does actually get worse. So it can be kind of a self-fulfilling prophecy. The flip side of which is this sort of use it or lose it principle, which I'm sure you've heard about in the context of aging, where we want to keep, exercising our mental abilities and skills on a regular basis to keep them sharp, to keep them from deteriorating. It's the same with memory, okay? So the worst thing to do if you're worried that your memory is going to fail you is to assume that it always will and avoid using it. So keep using your memory. The second thing is getting the stress under control. So I've talked about in a few different ways how stress can interfere with optimal memory functioning. So learning about how to cope with stress effectively, whether through the relaxation techniques or meditation or other kinds of strategies that can help with that, all may be important. And then managing some of the negative self-talk around the memory lapses. So it's common to have upsetting thoughts come to mind in anticipation of a memory failure. So, you meet somebody and they start talking, they're just about to introduce themselves, and all that's going through your mind is, I'm never going to remember this. Oh my God, I'm going to look like an idiot. All that sort of anticipatory anxiety and the associated thinking can get in the way of you concentrating and actually setting yourself up to remember that person's name as best you can. When you experience a memory lapse, also your thoughts about it, about yourself, like I feel useless, or your thoughts about what other people are thinking in this situation, or about what it means for your future. Again, all of that can just contribute to stress, take up some of your attentional resources, and make it harder for you to actually remember things. So getting these under control are quite important. So I know the BC Brain Wellness Program has resources and other recommendations for how to get this kind of help with, meditation and relaxation, counseling, these sorts of things. So we just encourage you to seek that out if this sounds relevant to you. And this is just an example of how the sort of self-critical thinking can spiral out of control and over time just feel more and more true because you're always saying it to yourself. So in the situation, there's some anticipatory thoughts, I'm not going to be able to cope, I'm going to screw this up. And then perhaps because of that, not remembering everything, noticing it because you're hypervigilant to those memory lapses, and then having more negative thoughts about the memory lapse and so on and so on. I'll just mention another useful resource here. The website is neurosymptoms.org, and they have a page on functional cognitive disorder that I think is quite good. It gives some background information about the condition and what it looks like and how to cope with it. I'll just also mention that our training clinic in psychology at UBC offers some low-cost psychological services. I think self-referrals open up again this July for the fall, and those this can be a resource for getting help with anxiety or depression, and also for neuropsychological assessment, getting the cognitive testing to figure out whether memory is actually functioning okay or not. Just want to acknowledge some sources of research funding here. And leave you with some direction about how to keep in touch with the research we're doing on our lab if that's of interest. Thank you.
Thank you so much, Dr. Silverberg, for that wonderful talk. I know that forgetting and memory can be really frustrating, so it's really great to learn a little bit more about the nuances of this and to get some really helpful takeaways. If you have any questions for Dr. Silverberg, please type them into the chat. We do have quite a few questions here. So to start, what's the proportion of men and women in these studies that you discussed earlier, and how much do hormones influence these findings?
Yeah, that's a great question. So in cohorts of FCD, so research studies that look at a group of people with FCD, there tend to be more women than men. The question about hormones is a terrific one that I do not know the answer to. So I suspect the answer is some. We know, for example, in the perimenopause phase, cognition tends to be affected. And there may be, other ways that hormones play a role in day-to-day memory functioning, both in FCD and other situations and conditions as well. But I don't know an answer better than that, I'm afraid.
And so do women and men experience rates of dementia? Do they experience different rates of dementia, I guess, just in general?
Yeah, so I'm not a dementia expert, but my understanding is that women do experience higher rates of dementia, perhaps in part because they live longer. And the thought is, we will all have some form of dementia if we live long enough. And it's really just a matter of age, more than other things.
Right. Okay. And then going back to those studies, how does neurodivergent factor into these findings?
Yeah, I don't think we know the answer to that question. So most of the work in FCD, including our own, takes people who were functioning pretty normally through adulthood and then have experienced some change in their health. In the work that we do, more so after concussion, but as I mentioned, lots of different triggers or situations can bring about FCD. And I'm not aware of a lot of work, going back to development and tracking forward to try to understand maybe earlier vulnerability factors or contributors to the problem.
Yeah, I'm sure there's a lot that's still to be uncovered. Another question here, can you discuss the logical sequence of movements and how they relate to memory? So for example, starting a task like turning on the water or turning on a light, and then not following through with the completion of the task. And is that something that can be improved?
Yeah, I can do my best. So it sounds like the person asking that question is referring to prospective memory, which is the fancy way of saying memory for intentions, remembering to do something in the future. So the first step is, of course, you have to form an intention that you can't execute right away. You want to do it at some later time. That's what makes it a memory task, right? And even walking down the hall to another room is enough of a delay to make it a prospective memory task. You then have to have the experience of recalling an intention. So there was something I was supposed to do. And ideally, you can also remember the content of that intention. The thing I was supposed to do is such and such. Now you can have one without the other, right? And that's the common experience of walking into a room like, oh, I know I came in for a reason, but I can't think of what it is right now. That's a really common failure. The other thing that makes prospective memory so hard is that often we have to bring to mind the intention on our own. There's no cue or prompt. So for example, like let's say I have an intention, I want to call, my neighbor back later, and I file that away for a time when I can. I have to remember to do that all on my own, which is much harder than say, when I see somebody, I want to pass on a message. So just they're seeing them coming face to face with them might prompt that memory for me that, oh, that's a trigger. I know I was supposed to say something to them, but again, there might be a breakdown in accessing the content of that intention. So what was the thing I was supposed to say to them?
Right, great, thank you. What about your ability or decreased ability to multitask, and what does that tell us about memory?
Yeah, so multitasking involves prospective memory because you've got to keep track of something that you want to get back to while you divert your attention to something else. So I think about multitasking as not a real thing. Like we're not actually doing multiple things at once. What we're doing is flexibly shifting back and forth between ongoing tasks, right? And so it's related to memory in the sense that as soon as you leave a task, you've got to remember where you left off and that you want to get back to the other one. So I see that as the interface.
Okay, great. Is there any indication that multiple concussions in youth can result in dementia through time?
Yeah, that's a really good question that there's a lot of interest in now. So it's been an evolving story. What we know, what we're pretty confident we know, is that having one or two concussions does not have lifelong implications. That repetitive head trauma, such as through participation in contact sports for many years, so not necessarily head impacts that cause concussion, but just lots of head impacts that do enough to sort of rattle the brain a little bit. We'll pick on football for a moment. Depending on your position, you might have more than 1,000 of those in a season, and you may play many seasons. And so there seems to be some kind of cumulative effect there that is more important than the number of concussions that you've had. Okay. So that if you had a couple of concussions, but you have not had thousands of those blows to the head, you'll probably be better off than somebody who's had thousands of those blows but no concussions. But chances are those folks have also had concussions because they kind of go hand in hand, right? The more you get your head knocked around, the more concussions you get. There may also be something about experiencing repetitive concussions close in time, like when the brain hasn't had an opportunity to fully heal. That seems bad. So if you've had, 2 or 3 concussions, but they're spaced out like a couple of years in between, again, chances are that'll be fine. But we worry more so when they happen closer in succession. But there's no magical number where you can say, if you've had at least 3, you're at you're going to get dementia. We also know that a traumatic brain injury of any severity through the lifetime is a risk factor for dementia. And we don't know much about the additive effect of multiple concussions to that risk, but there does seem to be some association. Like if you look at large populations between head trauma in earlier life, severe enough to cause traumatic brain injury, and the development of dementia later. There is some risk, but there are, it's not like if you have this happen to you, you're going to get dementia. There are many other factors that contribute to whether people get dementia or not in later life.
Great. Thank you. Does knowledge of multiple languages and forgetting certain words in a particular language happen as you age?
Oh, that's a great question. So it might relate back to the sort of use it or lose it thing. That's less about aging and more so just about this phenomenon of if we don't access information in our brains frequently, the connections and therefore access to that information deteriorates over time. It's sort of a way of signaling to your brain that this is not critical information to hold on to. Um, and so that's a common experience that we learn, a second or third language, but then, through some decades barely use it, you're definitely going to lose it. People who are, perfectly bilingual or trilingual and in the aging process, or even after a brain injury or stroke, their languages tend to not all be affected in exactly the same way. The language that you learned first and perhaps you're most fluent in may be most resilient to the effects of aging or disease. And the languages that you learned later or at least fluent in may be the first to go, where you now have struggle to find the English word even though you can still remember the word in your native language. That's definitely a common thing.
Very interesting. Okay, great. We'll see if we can get to a couple more of these. I know we're running out of time, but what is the difference in processing when forgetting something versus not recognizing a misplaced item that's actually found in full view? So I guess the process of forgetting an item versus not recognizing something that's there.
Yeah. Okay. So like pulling to mind a memory is a much harder task than seeing something and recognizing it as familiar or not, or yours or not yours, or something like that. So I would say certainly like what we were talking about today with FCD, problems with recall, like just bringing to mind on your own, what somebody's name is or what a password is, that's harder and it's common to fail. I would say that seeing something right in front of you and failing to recognize it as familiar when it should be, that may signal a more serious memory problem that we wouldn't really see with FCD.
Okay, great. Good to know. Well, thank you so much. We are just getting to the top of the hour. So this has been absolutely fascinating and I think, very helpful and insightful. So thank you so much for your time, Dr. Silverberg. And thank you to everyone for joining us today. Have a great rest of your afternoon and we hope to see you all soon.
Thanks for coming, everyone. Thanks for having me.